Hey, welcome to another LTC 360 where we cover a long-term care topic in a little under 4 minutes. Today I want to focus exclusively on what I think is perhaps the most exciting generational new member product or service that we've introduced at the association in a really long time. The Iowa Healthcare Quality Partners is a new product that is a contract network that brings our member providers together to jointly negotiate better terms better contract terms with Medicare Advantage and other insurance companies that you deal with on a reimbursement basis. This is a network that will leverage the volume that we have in our association to provide a bigger seat at the negotiating table collectively to ensure better contract terms for those members. You know, this is a network that will ultimately be certainly working initially toward better contract terms, and really what this is designed to do is to provide better clinical and financial integration designed to deliver better quality out in our network and provide incentives for our members to do that. So I'm extremely excited about this. This network has demand for the network, interest in the network has substantially outstripped what we expected initially when we rolled this out at our convention. And we're currently in the process of having interested parties sign participating agreements to be engaged and ready to go as the network rolls out toward the end of January next year. So how do you get involved? Number one, you can research this a little bit on your own. If you visit iowahealthcare.org/qualitypartners as a logged in member, there's a lot of resources there to familiarize yourself a little bit more about this. And then the next step is for you to reach out to Brandon Hagan here at our office. You all know Brandon. He's our Vice President of Reimbursement and Managed Care and is managing this network for us. Brandon's working with the American Healthcare Association to stand this network up. So we're leveraging our connections and our network with national experts to contribute and effectively manage this network for you. Talk to Brandon. He can take you through what the participating agreement looks like, what you can expect out of the network in 2020, and why it may be the right fit for your member facility. Timeline for this, as I mentioned, we have received hundreds of letters of intent showing formal interest in participating in the network from members, and they are now in the process of signing participation agreements which will reserve their spot in the network. We expect the network to be formally recognized and organized by January of next year, begin negotiating contract terms with those Medicare Advantage and insurance companies in the second and third quarters of 2020, and ultimately result in better contracts toward the end of next year. So this is extremely exciting. I'm inviting you to get yourself involved and interested at this point because, again, interest has been so strong. We do expect the network to become fully subscribed, and this is on a first come and first served basis for members. So I encourage you to check it out. I know you got a ton to do toward the end of the year as we ramp up to the holidays, but I think this is something that may make a real difference for your facility as it relates to reimbursement and quality in the coming years. So thanks again for spending a little time with us for LTC 360. Happy holidays, and we'll see you next year.